Dr. Avinash, Consultant Gastroenterologist at Bengaluru. This is for a patient initiative education on viral hepatitis. So hepatitis is basically inflammation of the liver, and majority of the patients will present with flu-like symptoms, that is nausea, feeling like vomiting is called as nausea, vomiting, right side, upper side abdominal pain, distaste to food, as well as alcohol. So we think about a possibility of inflammation of the liver, what we call it as hepatitis. In more severe situation, people may develop yellowish discoloration of eyes and urine, what we term it as jaundice, leg swelling and abdomen swelling, what we call it as fluid retention, and some of the people may have bleeding tendencies and unconsciousness. These are all more severe entities. So at that time, the doctors will be doing what is called as a liver function test, like how exactly is the liver functioning. We look at the bilirubin, we look at the protein, and we look at the enzymes. If the liver enzymes are high, then we look at multiple causes, starting from alcohol, obesity, what are all the medication that the patient is taking, and predominantly the focus for today's topic is viral hepatitis, where the doctor will be checking on hepatitis A, B, C, D, and E. So these are all the 5 common viruses which generally attack the liver. So out of which hepatitis A and E are because of food or water contamination. So it can be avoided by doing hygienic practices and getting vaccination. More important for long-term liver health is hepatitis B, C, and D, out of which B and C are important. So these are all predominantly either by using of infected needles or blood transfusion or sexual transfusion. So predominantly we check for HbSAg and then we look at the DNA markers. So we can do an ultrasound abdomen to look for whether the liver is acutely infected, or it is a chronic liver disease. And some of the patients might undergo liver biopsy to look at underlying liver cirrhosis. Depending upon that, we have more potent medications like entecavir and tenofovir, so which have got least genetic barrier, that is the chance of the virus developing resistance to that molecules are much lesser. So you will be kept on entecavir or tenofovir if at all a patient is fitting into the treatment category. Similar to hepatitis B, in hepatitis C, catching an acute hepatitis C is less likely unless in a dialysis setting. So chronic hepatitis C again will require liver function test, ultrasound abdomen plus minus liver biopsy. Again, potent antivirals are there, sofosbuvir, velpatasvir, so which are all can keep the hepatitis virus under check. So between B and C, hepatitis B has got a vaccine. So like nowadays it is universal vaccination program where every newborn is going to get a hepatitis B vaccination. So like all 3 doses have to be taken only to the arm, that is the deltoid, 0, 1 and 6 months. So if at all a person is vaccinated for hepatitis B, it gives us 95% immunity for contracting a hepatitis B virus. So most importantly is exercise regularly. So avoid alcohol, eat hygienic food as well as water. So prevent unprotected sets. So regular checkup with doctor to look at how the liver functioning as well as the metabolic parameters of diabetes, hypertension, cholesterol are under check or not under check. So these are all like good liver health practices. Thank you one and all. Stay healthy, stay safe liver.